Hi, my name is Dr. Felicia CATARELLA, and I'm a physical therapist and strength and conditioning specialist here at Balance Physical Therapy. Today I want to talk to you guys about a condition that's near and dear to me because I do have this, and it's called foot drop. And foot drop can be caused from a number of things. It can either result from an injury to the brain or spinal cord, such as a stroke or a spinal cord injury, but it can also result from an injury to a nerve root or peripheral nerve injury. That can happen from, a car accident, a crush injury, or, sometimes a surgical procedure where a nerve gets bumped or nicked, and which can result in an injury to that nerve and subsequent weakness. Sometimes the nerve doesn't heal and you're stuck with weakness in the foot, and depending on how severe the injury was, you may have no movement of the affected muscle, but you might have some. So just to give you an example, peripheral nerve injury to the peroneal nerve, which is part of the sciatic nerve, it runs down here. And what it does is it innervates the muscle called your anterior tibialis. And if this nerve is injured, it's going to affect this muscle's ability to work and function. So for instance, this side, I have no injury and I can lift my foot all the way up without problem. I'm able to clear the ground when I walk. On this side, if I try to lift, that's about as far as I can get. I have very little movement. And so this can be problematic when I'm walking because I can't lift my foot to clear the ground during the swing phase of gait. So to combat this weakness, there are devices called AFOs, or ankle foot orthoses. And there are many different types. This one in particular is a TurboMed external AFO. And it actually goes right on the outside of my shoe. I can hook it right on. There are other ones that go inside the shoe that can also help in the same or similar way. And so finding the type of brace that's best for you can be something that you do with an orthotist, but your physical therapist can also help guide you to the proper fit and recommendation for an AFO that might work for you. And not one AFO is perfect for everyone. So I want to take the time to show you guys today how much of a difference wearing a brace can make on your gait and how much it can improve your function and reduce pain. Okay, so now I'm going to start walking, and I'm not wearing my brace at the moment. So when I walk without my brace, I have to walk a little bit faster so that I have the momentum to clear the ground, and I kind of flick my foot up. But with this, I irritate my hip a lot, and it's very painful. So that's one of the reasons why wearing a brace can be so much better for patients with this condition. Not to mention, it's safer because you're not going to trip over your foot. So I'm going to show you guys what this looks like, what a foot drop looks like. So as you might be able to see, my left foot doesn't clear the ground as well as my right, and my right heel strikes the ground better than my left. My left foot will just kind of flop and slap to the ground here. Now, when this injury first happened due to a car accident for me in particular, I couldn't move my foot at all, and it was a much more dramatic foot drop and I had much less movement. So it looked more like this, and it was more dangerous for me to walk. So I had no lift at all, and my foot would drag the ground, and I would trip over it, just as you're seeing happen now. So with physical therapy and strengthening, I was able to regain some function and strength back, but I didn't get it all the way. So for that reason, I wear a brace called the AFO. So for the external AFO, or the TurboMed, what you do is you end up getting a clip that goes on your shoe. And so you can attach it to the eyelets with just something as simple as a zip tie. And I actually like to keep multiple extras with me in case it breaks, because I'm pretty rough with my physical activities and sometimes it just wears down. So the clip goes here, and you want to make sure you have shoes that have a good strong eyelet for it to attach to. Then you take the brace, you clip it right on, and it hooks right into the heel part here. And it should be nice and snug. It shouldn't really be sticking out too far. When you go get fitted for one of these, they'll be able to help you adjust how long it is for your shoe size. And then you get your shoe on, which can be tricky. When you have nerve injury, it's hard to get your foot in a shoe. My trick is to go a little sideways, then twist and push. Then there's strap here, goes right around the calf area, and it's very comfortable. I've never had any issues with it. There's padding in the front and padding in the back. And I've actually washed the padding as well, and it's still fine. And now you guys can see the difference between wearing an AFO and not wearing one. So now when I walk, I'm not gonna have to overuse my hip flexors to help clear the ground. I'm not gonna have to use momentum, and I'm not gonna be tripping over my foot. So I have a nice normal gait with normal heel strike on both sides. And I can move and walk with little to no impairment at all. And it's much safer for me, and it's less likely to cause pain. If you found this video helpful, please visit us at balancept.com on our website, or you can check out our Instagram. Thank you.